It is not the intention of our content to substitute professional medical advice, recommendations, diagnosis, or treatment. Always seek medical advice from a qualified physician or a health provider with any questions or concerns you may have regarding a health condition. Thank you.
Hello everyone, I'm Dr. Peña and today I would like to talk to you about eczema. Let me tell you, eczema is a very common skin condition of our children, and it is characterized by dry skin, dry patches of skin that are sometimes scaly, very itchy, and they vary in color. They could be red or brown looking. It all depends in the skin color of our children. It usually appears in the face, appears in the elbow creases, or even in the back of the knees. But it actually can appear in any part of the body. Eczema is usually hereditary, so it's not uncommon to see eczema history in one of our our kids' sibling, or a parent, or any other family member. And sometimes it is also associated with other type of diseases or allergies, for example, seasonal allergies or allergic rhinitis and asthma. It's not always the case, but it is very common that it is related to those diseases. The main thing that I want to tell you today is that the most common trigger of eczema is skin dryness, and that's why it's so important to keep our children's skin really moisturized. All our kids, it's very important to have a very good skincare, but mostly and most importantly, our kids with eczema. And it's also important that the type of products that we use to treat our children with eczema should be products that have no fragrance, and that they are hypoallergenic or for sensitive skin. And the reason for that is that sometimes the fragrances uh, that are added to the products to take care of the skin, they sometimes can have some chemicals that could irritate the skin and flare up the eczema even more. Another important thing that I want you to know is that when we give our children a bath, it should be towards the cool side. Try to avoid too warm water, because sometimes that can lead to skin flushing, and then that leads to more skin dryness, more itchiness and irritation, so that can worsen the eczema or even exacerbate it. And then I always recommend to in order to keep the skin really moisturized, when our children take a bath, before you dry their skin, you can use petroleum jelly and put it all over their body, and then patchy dry it and avoid rubbing the skin, because sometimes that can lead to more irritation. And then if you do that, if you put the petroleum jelly before you dry the skin and then patchy dry it, that will help to absorb more of the products, and that can lead to better skin moisturizing. Also, I want you to know that although good skincare can help and even treat the eczema lesion, sometimes the lesion needs a more like detailed evaluation and medical treatment. So that's why that when your children's skin is not improving or just getting worse, you need to go and get the help of your pediatrician, and then it will lead to a more detailed evaluation, and there's certain medications that could help to improve or even heal this eczema lesion faster. Also, it's important to prevent itchiness. Although skin moisturizing can help to prevent itchiness, sometimes our children need the help of some antihistamines such as Benadryl, especially for nighttime, because sometimes if they scratch it too much, that could lead to secondary problems such as skin infection. So that's why it's also so important to help to prevent the itchiness. Well, let me tell you, I really hope this video helps, and I really want you to, if you like it, to click it like. I want you to subscribe to get more videos, and also I really want you to comment and tell me your experiences about eczema, or with eczema, and I would like you to ask me any question that you have, and I will respond to that question as better as I can, and I'll be happy to it. So thank you so much. I really hope you like this video, and I see you next time. This is Dr. Peña, and bye bye.